Hi, everyone. Welcome back to the Sports Performance Podcast. Welcome all new listeners and welcome back to those who have heard our content in the past. Today's episode is all about back pain. But before I dive into back pain and helping you feel better, what is new at Sports Performance? We have an upcoming back pain class that for those of you who are local in the San Diego area, I welcome you to the class. We have two options this month. One is on June 21st, that is with Dr. Jason, and on June 28th, that is with me at our Chula Vista location. So I'll explain more about that as we go on. But yeah, let's talk about back pain and why are we talking about that topic right now? So I don't know what is in the water. I don't know what is happening, but we have been seeing more and more clients frustrated with back pain more recently, more than before. So fun fact, during COVID, we had more people come in to see us for foot pain, for back pain, for neck pain, and carpal tunnel. Well, people were at home and working from home, so they were on the computers more. They were also on their phones and screens more, so they were hunched over, so we had a lot of neck pain, but also a lot of back pain. And then the foot pain was because they were at home, they were in bare feet or sandals more often, and their feet weren't used to how much tolerance there was. So right now, we're going through this season of low back pain, and because of that, I've had numerous conversations with tons of clients, both in person and virtual, and I wanted to share with everyone what we're going through and what we're seeing and the recommendations that we're giving to people like you so you can have that resource at home and you can be able to navigate this on your own as well. So I have some notes down here. So we're going to go over this 5 critical habits to create lasting pain relief. And now we're talking about chronic back pain, recurring back pain. If we're talking about sciatica, it's a little different, herniated disc, all these other things. I'm talking about generalized low back pain and without symptoms going down the leg. So this is for somebody who has back tightness, stiffness, is waking up with morning aches and pains, sitting for a long period of time. They can't work out because of back pain. They can't run. They can't move. They can't twist. Those type of things. That is who I'm talking about here. So I'm going to go over these 5 critical habits, and genuinely I can say if you can understand these 5 critical habits and you can implement them, you'll be on a journey to be able to have lasting relief, not because these are magical things. It's because consistency is everything. Consistency across all these 5 domains. And I was very fired up recently. I just recorded a client testimonial. Thank you, Rose, for doing that. Someone here at Sports Performance. And, they were talking about, what they enjoy, why they enjoy being here and the simplicity. And one of the things that they said was, I like the comprehensive approach here. I love being here because I feel cared about, but also I love the experience when I walk in, everyone knows me, but also because I have access to everything at my fingertips. And this fired me up, but also kind of got me a little teary-eyed. And they said, because I feel like an athlete, but I'm not pushed away, and I don't have to be an athlete. That was her exact quote, an athlete to come here. And I said, that's the real reason why I created Sports Performance was people like you, who I truly believe everyone's an athlete. I think everyone can be active. And I think when you go to other providers, surgeons, doctors, maybe you don't fit that profile, right? Maybe you're 40, 50 years old, you have kids, you can only work out, so often. Maybe you're not in the gym 7 days a week, but you're there 3 to 5 because you're busy navigating your daily life. You've got work responsibilities. Maybe you're not as motivated some weeks, or you have a lot of stress, or you have, family health issues, or whatever it is. And the reality is we exist because we understand that. And we are all about pushing people and motivating them to get to the goals that they want. And sometimes they just need that support system. Sometimes they need an ear. Sometimes they need exercise. Sometimes they need direction. Sometimes they need a little bit of everything. And today I'm gonna share the conversation that I had with Rose, but also with all the clients that we're having with recurring issues, specifically back pain. So Let's start with the first one, right? So there's a lot of reasons why people have back pain. And I don't want to talk about, what shows up in your MRI, degenerative disc disease, herniated disc, whatever it is, right? Those are different. I'm going to separate those two. I'm just talking about the symptoms that you have, because those findings on MRI don't correlate with your symptoms you have. So let me just keep it simple. If you're having recurring back pain, disregard your MRI. So the first thing is exercise and general activity, right? So how do you conquer back pain without looking at the specifics of how your back is moving, your posture, everything that should happen? If you are not exercising 3 to 5 times a week in some form or fashion, you will always have back pain, especially if you're after 40 years old. If you're older than 40, you will always have back pain. Let me say that again. If you're over 40, you will always have back discomfort, limiting your daily life. Like it's a part of it, right? So the question here is, well, how do I mitigate it? I don't want to live with that. So the easy part to do here, you're going to do these 5 things. The first one is you're going to exercise 3 to 5 times a week. And I'm talking about breaking a sweat and consistent working or movement for minimum 15 to 30 minutes. Now, general guidelines are if you're working out 2 days a week, it's just for maintenance, meaning you're not even improving. Meaning if you're 40 or 50 years old and you're working out 2 times a week, you're actually declining in health. So 2 times is barely making it with maintenance. 3 times a week is important, is a good improvement, but 3 to 5 is where you need to be. And if you can get to that 5 consistently, you will have generalized low back pain much less than you think. If you can start there before you start going to spine surgeons, seeing a physical therapist, massage therapist, let's just try and get you to move more often. Because if I can get those joints lubricated, it's like the Tin Man. It's so stiff and so achy. The minute that you inject a little bit of fluid in there, it's like WD-40. It feels better, and that's what exercise does. So the first step to really creating long-lasting relief, can I get you to exercise 3 to 5 times a week? As I was having this conversation with Rose, the reason why I have this philosophy, and you won't find this anywhere else, is because I used to work in professional sports where there was 9 different medical professionals to one athlete: an athletic trainer, a physical therapist, a nutritionist, a massage therapist, a physical therapist, a doctor, a PA, a surgeon. All these people had different brains towards, okay, why is this person having pain? What do they need to do with their performance? And what I did was essentially, I worked in pro sports for about 10 years, and I took that philosophy and I gave it to my community, and that was why I wanted to do it. This is why our company exists, for people like you, like Rose, who are 40, 50, 60, who feel like they can be more active, but no one's giving them the chance, or giving them the stale, same process where you get out of pain, you go right back to your routine. No one's helping you to that next level. No one's giving you nutrition support. No one's giving you exercise recommendations. No one's giving you gym routines. No one's giving you that support system that creates that momentum to get you there, but also to keep you there. And that's why your back pain keeps coming back, because you go to the doctor, they tell you to go to PT or massage or whatever it is, take pills, do anything. You're actually not increasing your activity level, you're actually declining. So what do they say? Rest for 2 weeks. Great. Then you go to your physical therapist who gives you the same 50 exercises. You go see a technician. They make you feel better. We call that baseline. And then you don't go back to the gym. They discharge you. And then you don't go back to the gym. You keep doing the same things over and over again. You keep hurting it. You have to go back to the doctor. It's just this wheel. So how do we get out of that? That's what these critical factors are, these habits. So number 1, you got to move more than 3 to 5 times, more than 2 times a week. So 3 to 5 times. 5 is ideal. Get there. Okay. Number two is mechanics. So this is where the physical therapist, your rehab professional comes in. So there is an important component of how you sit, how you move, how you stand, how weak your muscles are, how stiff they are, how inflexible or how mobile you are. That's when you need to consult with a physical therapist, but not somebody who just is trying to get you to your normal daily activities. No. We want to get your mobility, strength, and flexibility to the point where you're exercising again, whether that's running, pickleball, golf, I don't care. So I don't want to get you to baseline and just your daily activities. I want to get you stronger than ever and keep you there. Now, that's the problem for a lot of people. They find a lot of physical therapists who they just want to get them to baseline, and that person's like, great, I still don't know what to do in the gym. I still don't know how to get myself to this point. And that's why you want to find somebody who's specialized, who can take you to the next level. And it doesn't always have to be the one recommended by your doctor or has all the fancy initials, because a lot of times those fancy initials were basic credentials to help them, move advance in their professional development, not necessarily clinical skills to be able to help you, perform at your best. So number 1, exercise 3 to 5 times a week. Number 2, fix your mechanics. Go consult with somebody to improve those. The mechanics will get you to baseline, but I want to get you to fitness. Great. Then we get you into fitness, and then you go to the gym 3 to 5 times a week. So those are 2 critical habits that you have to do. Work on your mechanics, get consulting education. But most people think that you go to physical therapy just because you want to learn 5 rehab exercises that are really going to make the difference. And that's not the case. That's important for you to know, but that's why YouTube and everything else don't work, because they don't integrate that into your gym or fitness activities. Maybe you like doing yoga, and maybe you need mobility in yoga, not necessarily just mobility and bending forward, or with running mechanics, you need specific mobility exercises for the things that you love to get you there and keep you there. Okay, so number 1, exercise 3 to 5 times a week. Number 2, work on your mechanics, work on your posture to get you the right exercises to get you an ideal position for your fitness activities. All right. The third one is a sensitive topic for a lot of people, and it doesn't apply to everyone, but you do need to be aware of it. Now, your weight. Your weight does play a factor, not just because of the total amount of stress on your joints, but also from the mechanical standpoint. So if you have adipose tissue, belly fat, and that is on your stomach, and that protrudes forward, that puts a lot of pressure on your low back and creating that arch. And you've seen people with that, right? So, if you do have a lot of adipose tissue in your, stomach area, that pushes that belly forward, puts a lot of torsion on that back, and creates a lot of stiffness. So even if you were, this is why going to physical therapy without having this conversation is very tough, because a lot of times they won't have that honest conversation with you. They'll promise that these 5 exercises are going to cure their back pain. No, you need to move more, get in the gym. You also need to work on your mechanics, but also be aware that maybe your weight and your nutrition are a critical factor on this. So I'm not saying to lose weight. I'm not saying anything about this, but if you know intuitively the demons in your head that are speaking to you at night are saying that you need to lose weight and your back pain is a portion of that, stop looking for rehab exercise to solve your problem. Stop looking for the gym to solve your problems. Maybe start looking at your nutrition and how to manage that a little bit better. And that's why you want to find somebody who does all of these things, somebody to keep you in the gym 3 to 5 times a week, someone to give you the mechanics, and someone to help you and consult with you to give you nutritional support, to talk about the things that you need to know. How many calories, how often should you eat is important for this, macronutrient. What do I need to do for my lifestyle? Okay, so those are the 3 things so far. Number 4 is sleep. You need to be tracking and aware of your sleep and how many hours you are sleeping, because that's when your body recovers. So think about this, right? And this might be you. Maybe you don't work out 3 to 5 times a week. You work out 1 or 2. Okay. Number 2 is you've been looking on YouTube for magical exercises that are going to solve your problem. Number 3, you've sought out mechanics from the bare minimum physical therapist who hasn't been able to solve your problem because you're just going through the wheel of your insurance carrier. Number 4, they haven't discussed, or number 3, they haven't discussed the nutrition and weight with you. So you just keep going in the cycle. Go to therapy, get exercises, go back to your doctor, no improvement. But no one's having the conversation of, great, you have to attack this from a multidisciplinary, comprehensive approach. Get in the gym, get more active. Work on these mechanics, start looking at your nutrition so you can drop some weight. And then also you have to factor in, you got to sleep more. You got to get to a point where you're maximizing your recovery. That's when your back heals. So you have to think about this. Exercise is stress. And when you are exercising, that is applying stress to your body. And when you sleep, that's when it recovers, becomes more resilient, and you put yourself in a better position. So if you are not sleeping, you're sleeping 4 to 5 hours a night, your back is not recovering. That's why you have constant backache, because you're applying stress and not recovering. So if you've got minimal movement in the gym, you're not consulting with a proper healthcare professional for mechanics, you're not watching your weight or your nutrition, and you're not watching your sleep or monitoring that, your body is in a stressful position, in a stressful situation. That's why it's so tense and tight. These things can help alleviate that and give you a break for good. And the last one is truly stress. Stress, we all have that in our lives. It could be, right now my kids, for those of you who don't know, I have 3 kids. I have my son Jacob, who just turned 4 years old today. My daughter Alex just turned 7, and my son Zach is about to turn 9. And it's a stressful, time in life. You want to give your kids attention and all these other things, and you have life situations and your own personal health and family health and all these things, and you're spinning multiple plates at the same time. But it doesn't mean that you don't take care of yourself. And the way you track that is your resting heart rate. Get a wearable. What I mean by that is you've seen Apple Watches, you've seen Oura Rings, you've seen the Whoop band or some type of wrist, device that tracks your heart rate. And the reason why that is because your resting heart rate is a measure of your stress. So if your resting heart rate is, say, normal is 60 beats per minute, and during certain times when your back pain is going up, it's 80 beats per minute, it's because you're constantly stressed, you're tightening up, plus you're not sleeping, so you're constantly stressed, you're not working out, and you've been gaining weight. Well, rehab exercises aren't going to solve that. And you need to know that. Don't fool yourself by going to more physical therapists, more massage therapists, more chiropractors to solve your pain, because what you're missing is the elements that have nothing to do with your mechanics. And this is a whole picture. So you want to be able to do all 5 of these things. But I wanted to bring this to your light, to your awareness, because I think that people are they're not lying to you. They're just not having an honest conversation on how to do this. And this is born and bred from working in pro sports and seeing what elite level athletes get access to. And this is all we do with professional athletes. We just track these 5 elements and just see where the resting heart rate is, see where the sleeping is, work on their mechanics, keep them active, and start working on their nutrition. And what that allows them to do is just perform at their best, live a good life, and be able to do that. And if you want to live a more active life, a healthier life with less restrictions, less back pain, you're probably missing 4 of these elements. You're probably going to the physical therapist, you're working on your mechanics, but that's 1/5 of the whole equation. You have to stay active. So what if you're in the gym and you're working on your mechanics? You're still missing 60% of that. Your sleep, your nutrition, and your stress. Start monitoring all of those. So look at your resting heart rate. Start and wear a wearable at night so you can look at your total sleep time. Wear that'll tell you what your sleep is and what your stress is. Start paying attention to your nutrition. Maybe download an app. I think the one that I use, My Fitness Pal or something like that. I have no affiliation with them. It's just one I personally use. It's free and it's easy to have on there. You type in the food, it tells you how much it is, and you can just track it. So find yourself in a better position to be able to navigate your back pain without just relying on exercise and YouTube videos to do that. This will put you in a better position. So the reason why we started doing these things is because we saw more people having back pain. And for those in the San Diego area that are looking for a different perspective, why their back pain hasn't gone away, you need to attend our free back pain class. It's called Overcoming Back Pain, How to End Chronic Back Pain and Prevent Future Injury. If you're interested on that, click on the link inside this podcast. But other than that, I hope you guys are doing amazing and staying active and away from back pain, because it's very possible, it's very fixable. You just don't have the right guidance and direction. And if you need support with that, whether it's virtual or in person, reach out to me and my team, because there's simple things that you're not doing that I truly believe that will make a big impact, because we've seen it before. You just need the proper direction and resources. So I hope you're doing well, and we'll catch you on the next episode. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.